Hi, my name is Jennifer Miller. I'm a physical therapist with Baylor Scott White,
And I'm Rachel Cook. I'm also a physical therapist with Baylor Scott White Rehab.
and we've been asked to present again for Cowtown this year. This year, we're getting a little bit of a jump start with topics of injury prevention, stretching, and hydration. Uh, so, just a little bit about us. I've been a PT forever, 20 years. I've been a runner for a while. I've gotten into Ironman. So I can definitely speak to the topic of injuries. In addition, I'm an orthopedic specialist and I do treat a lot of orthopedic injuries in my clinic. And Rachel and I both shall go through. We both dry needle and love to treat sports injuries and runners.
Yeah, so I've been a runner for a little over 10 years, doing just multiple different distances. Um, I've been with Baylor for 5 years, and during that time, I've been able to treat a good variety of athletes and also do some dry needling if it's appropriate and if it helps their injury.
All right. So I wanted to, before we jump in, I found this in an older book by Amby Burfoot, and I thought these were really cool things to start this discussion with the essential traits of a runner. I know we're all unique. So, patience, balance, respect, humility, and stoicism. So, patience, and this will tie into our presentation to pace yourself and look at the bigger picture. We all have job stresses, family issues. We get sick, we get injured. And balance, which I think we all can struggle with. If you don't have balance, you're not having fun. But if you're having fun and training and running, then you probably have found your balance in something that you love. Also, moderation is the key for training. Respecting the distance, whether it's 5K or the ultra marathon. They can be intimidating. You never know what's going to hit you, leading to humility, keeps you humble. I think everybody's been humbled on a run or a race. And stoicism, which a lot of times we think of runners being tough, but we do have to have resilience and toughness to get through because sometimes it's not so fun. So we're going to hit on six key points for injury prevention. We're going to go through each one of these, but just a brief overview. Number one, avoiding too much load or overtraining. Number two is make sure you give yourself enough recovery, rest days, and sleep. We'll go through that here in a few slides. From a physical therapist perspective, strength training, foot core, foot intrinsics, and plyometrics or jump training. We're also going to discuss terrain choices and proper footwear. Flexibility, how you can incorporate that into your training to prevent getting injured, and hydration during training. So a lot of times for me, the most feared word for a runner is injury, because that means you can't run. And so I found some studies out there that up to 80% of runners get injured at some point in their career. Tends to be more with the novice runners versus the experienced runners, where they found out of 1,000 hours of training with a new runner, they got injured 9 times. I had 9 injuries. But with an experienced runner, out of 1,000 hours of training, only 4 injuries occurred. So another interesting thing I found was injuries do tend to peak 3 to 6 weeks after a training error. So you have to be really careful with your rest days and recovery weeks that you're not increasing your volume too much and you don't ignore that pain. Another thing is the number one predictor is if you've had this injury before. So you have that combination of maybe you had Achilles tendonitis and you started training for a marathon and you add too much load and you don't listen to your body, and then guess what? The Achilles starts to get sore. So that's something to think about. Another thing too is age. As we get older, we're going to get injured more frequently. As we age, our tendons become less stiff and we lose the elasticity. So that will definitely be a factor whenever you start to add in more mileage and work through your training program. And then some other things we wanted to touch on are other potential causes of injury, where I've talked about load, training load, when your tissues can't adapt to the intensity and volume. One point I wanted to make is I would recommend to never add intensity or volume at the same time, definitely during that same training week. Tissue quality might be a factor. I mean, the integrity of your tissue or your bone health. Also, one thing to consider is mechanics. This is what Rachel and I look at a lot of times with asymmetries or compensatory patterns. And of course, structure and physiology, the structure anatomically, what's going on with bone structure or genetics. And then one thing I always like to bring up is psychosocial stress, where lower mental well-being, the idea of being perfect can lead to overtraining or your sense of self. I read some studies to where you had the elite runners, they had an injury and they lost their sense of self and kept on pushing. So it's just part of the big picture that goes back to the previous slide with make sure you have balance as you move through your training program. Another thing too, we talked about this last year and the year before of how important it is for recovery. We want to touch on rest and sleep. That sleep is really one of the most important and easiest and cheapest thing that you can do in post-exercise recovery, your bad runs. CDC recommends 7 hours of sleep per night. So what good sleep can do, it can improve your performance, of course, decrease your injury and reduce the illness risk.
It's flu season, y'all.
Okay, so another thing here with runners, I think a lot of times we think, oh, we're a runner, I get enough exercise, I don't need to do strength training. And they have found that that is, in fact, very, very not true, very false. So it's more about getting strong in the process rather than being strong. So Rachel and I, when we treat patients in the clinic, we're adding loads, we're adding weight, we're adding progressive loads to the bone, tendon, ligaments, and the muscle. It's not just about having that nice bicep. There's so many more things going on in the background. Another really cool thing is there's a perk with lifting, because that does increase the tendon stiffness. And remember in the previous slide, we talked about it losing that whenever we do age. So that is definitely a big factor in injury prevention. As I said before, we can't just run to strengthen the tissues. That's not going to work. They've actually found that lifting heavier loads can improve your running economy by at least 10%, which is pretty amazing. And you don't need to spend hours in the gym. 2 or 3 days a week, 20 minutes minimum. And I would not recommend to do it on your rest or your easier days. So it might be that you do a quick strength training before you take off on your run or when you get back.
Okay, so one of the things that runners love to talk about is shoes. I know at least the two of us are obsessed at least a little bit with running shoes because that's basically all you need to get started. But terrain choices in footwear also contribute to injury risk. So it really depends on the amount of each of these that you're getting. So on different terrains, running your speed workouts on a track versus running out on the concrete. Are there hills in your neighborhood that you're going up and down frequently and downhill running? I know probably both of us have felt trashed in your quads after a lot of downhill running. So there are just differences that you have to take into account with the terrain. And it also matters on race day, right? When you're looking at the course elevation, that matters. And you want to try and get your training to match the course elevation as best you can. Obviously, nothing's perfect. Downhills, like doing a lot of repeated downhills can be too much. And again, stress those tendons in ways that you haven't stressed them yet in your training and can flare up some injuries. Trails may be good in some cases if you have access to them because the surface is softer. Not so much sand. Sand is actually more difficult to run on. And then also consider the slant on the road. If you're running in a road, it's cambered, so it's like a rainbow shape kind of. And if you're always running on one side, you're always tilted. So you want to consider how much of that you're doing and try and even yourself out as much as possible. And going back to shoes, I did some research and found that the softer and thicker midsoles help reduce impact through the rest of your foot. Minimalist shoes can affect your running economy, but the research on that isn't super clear cut. Really what matters the most is running in a shoe that you feel is comfortable on your foot. That's what matters. Don't force yourself into an uncomfortable shoe because you're not going to, one, like running in it, and two, it can affect your biomechanics in a way that you won't like. And then we always hear, how often should you change shoes? It really just depends on how much mileage you're doing. A rough guideline that I found was change them every 500 miles or 6 months. Now, obviously, if you're running, maybe one time a week, 6 months, maybe a little bit soon, but there are different ways you can keep track of the mileage on your shoes through different apps or just writing it down. Going on to hydration, you want to have a game plan because it's really important, not only on race day, but during your training, to have a hydration game plan. If you're like me, you're a very sweaty person and you need to put that liquid back in your body. So on race day, you should do what you've consistently done on your race simulation runs or your longer runs in your training plan. You want to essentially drink to thirst. So drink if you're thirsty, whether that means you're stashing water along the course or carrying it with you. And have a backup plan just in case something happens, because you never know what's going to happen on race day. Maybe you run by a table and there's no cups, or you miss the handoff with the nice volunteer that's handing you your water cup. You need to have a backup plan. Mm-hmm. Between 4 and 24 hours after the race is your main rehydration time, because you've sweated out everything during the race. You need to replace it. This is kind of a little specific, but I did see a study that if you drink at least 150% of the weight you lost during the race, your recovery after is better. So some people do, in fact, weigh themselves before and after and rehydrate that way. The other thing you need to take into account is the weather on race day, which we all know you have no control over, but it is a factor. If it's really hot, if it's really cold, if it's really humid, that's going to affect your sweat rate, how much water you lose, and how much you need to rehydrate. The other thing you want to think about is how long your race is. There's a big difference between how much you sweat in a 10K versus an ultramarathon. So that will determine how frequently and how much water you drink. Now, you've all probably noticed that there are a flood of hydration options in the market now. It seems like every brand and every company has their own hydration beverage now, and there's a lot to choose from. So which is the best? Honestly, whatever you will drink, whatever flavor you like to have on the run with you, whatever brand you find accessible, if you'll drink it, it's going to help. If you're someone who doesn't like plain water, this may be a good way for you to get hydration in you. I did find one article that Noon actually paid for a randomized controlled trial where participants either just drank plain water or Noon tablets dissolved in water during a marathon, and Noon resulted in less fluid loss and better fluid balance compared to the people who only drank water. And if we're talking about how you feel after a race, if you're more dehydrated, you're probably going to feel worse. I also looked at articles debating the different kinds of sugar that are in different hydration mixes, beverages, and there's really a minimal difference. So again, just whatever you will drink is best for you. And then you also want to take into account how much salt is in all of these hydration beverages, because they're going to vary by brand. Your muscles need salt to contract. And if you like a drink that has more salt or less salt, that's really up to you, but you want it to at least have a little bit of salt to replace what you're sweating out. And then active recovery. So we're talking about this after the race, right? You've done your main race, and now we're looking at recovery. You do want to do some cross training, gentle stretches and movements to decrease soreness, and that's going to be up here on the next slide. An ice bath or a massage can help reduce muscle soreness and perceived fatigue levels. I imagine those cryotherapy chambers would also be somewhat similar. And then everybody's probably seen the Hypervolts and the Hyper Ice and all of these percussion massagers that are on the market. You can use those as a self-massage technique along with your foam roller, which if you're a runner, you probably have. So about stretching, there's always kind of these two camps of thought of whether you should stretch before or stretch after running. And it really just depends on what you're looking for, what you're intending to do. Before the race, we're looking at more dynamic stretches, because those are going to improve your running form and decrease the perception of effort. So it warms up your body, and that way, when you do start running, it doesn't feel so hard. Stretching after is more of those long hold static stretches to help decrease some of that sore and stiff feeling after running. But these pictures here are just kind of some ideas to go off of getting the major muscle groups of your legs for before or after running. So if you are having pain with running after this race, like you finish and a few weeks later you try running again and you're like, wow, my knee really hurts or my ankle really hurts, you can either get a direct physical therapy consult with someone like me or Jen or your friendly neighborhood physical therapist, but you would also want to get a checkout from your primary care provider, just in case, something bigger happened that you would maybe want to get an x-ray for or some other testing done. But in Texas, we do have what's called direct access to physical therapy. So you can, depending on your insurance plan, go directly to a physical therapist and get evaluated without a referral from your doctor, if you've ever had that happen before. And so who are we? We're physical therapists. We've both been at this for a while. What we offer people, according to the American Physical Therapy Association, is all about optimizing movement to improve the human experience. So that doesn't just include running, that includes anything from your baby crawling to preventing falls. So really just about physical examination, diagnosis, prognosis, educating our patients on how to help themselves prevent injury, do exercises, and promote healthy behaviors.
Mm-hmm. Yeah, and just going off that previous slide, different things that we treat. This is, of course, a very shortened list. Sprains and strains, neck and back pain, or any orthopedic injury, hand, wrist, and elbow injuries, balance and dizziness issues or vestibular. Of course, we see people before and after surgeries. We do cancer rehabilitation and work-related injuries. So there's many things that we can do on top of running. We just had to throw that out there just to get the word out of how we can help everybody. And then just going back a little bit more detailed about direct access with the state of Texas. Basically, it saves you guys time, money, and we can get to you right away. There's different specifics with a time frame and that type of thing. So if you have any questions, of course, at the end of the slide, we'll provide contacts. definitely I would take advantage of that. We as therapists have worked for many years to have this direct access, so let's please utilize that. We would love to help you.
And what Jen and I and a subset of PTs here at Baylor Scott White is we do offer a specific service line for runners, as we call it. So what we do includes obviously just gait evaluation, right? Watching how you move, how you walk, but we also do video analysis of treadmill running. So what we do is basically just take a video of you running at a natural pace on a treadmill, slow that way down and look frame by frame at what do your knees look like? What do your hips look like? Are there any deviations in what you're doing that may be causing some of your issues, and really just break down piece by piece how you run so that we can help you with whatever your goals are. Both of us and other therapists offer dry needling if that's necessary. It's like those really thin hair-like needles that can help with some muscle problems. We also do joint and soft tissue mobilization if we find maybe one of your joints is a little bit stiff, or if you've got muscle knots anywhere that we need to work on. And then lastly, and most importantly, a clinical and home exercise routine, because we may only see you for 1 or 2 hours a week. What you do in the other days matters. So we'll give you a personalized home exercise routine of the exercises that are best going to help you with whatever you're hoping to accomplish. So as she said, this is our contact info. We span all the way from North Fort Worth down to downtown between the two of us. So Jen here is the center manager at our Carter facility downtown, attached to All Saints. And then I'm the center manager here at the North Fort Worth Fossil Creek location, just right off of 35 in Basswood. So if you guys have questions or just want any follow-up information, you can always either call us or email us, and we would love to talk to you. Yeah. And here are some references if y'all are curious. And then, of course, just reach out with any questions. But we just wanted to say thank you to Cowtown for having us and letting us give this talk again with some new and improved sections based on y'all's feedback. So thank you guys and have a great race.
Yeah, thank you. Appreciate it.